Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the sternocleidomastoid muscle. The sternocleidomastoid muscle is a large muscle. This is superficial and it divides the neck region into the anterior triangle and the posterior triangle. It originates from the sternum and clavicle and inserts to the mastoid process. So it is called sternocleidomastoid muscle. The sternal head is tendinous in origin from the superlateral part of the front of the manubrium sterni, the upper segment of the sternum, the manubrium sterni, from the superlateral part of the front of the manubrium sterni. The clavicular head, it is fibrous in origin from the medial 1/3 of the superior surface of the clavicle. Insertion to the lateral surface of the mastoid process. This is deeper. It is reaching the sternal head at the middle of the sternocleidomastoid muscle. So it is a little bit spiral and it makes this part, the connection between the clavicular part and the sternal part, then they go to insert here. So insertion, lateral surface of the mastoid process from the apex to the base, and also the lateral half of the superior nuchal line. The mastoid process is a part of the temporal bone. The superior nuchal line is a part of the occipital bone. Okay, so nerve supply of the sternocleidomastoid muscle, motor innervation by the spinal accessory nerve. This nerve also innervates the trapezius muscle and it passes over the posterior triangle area after supplying the sternocleidomastoid muscle. And this is the motor innervation to both the muscles, sternocleidomastoid and the trapezius. The sternocleidomastoid muscle also get the proprioceptive, the position and movement sense, that is the proprioceptive function, sensory function, by the ventral rami of C2 and C3 and sometimes from C4 also. Recent research has shown that some of the fibers has some motor function, although it is established that this is totally sensory, it is proprioceptive. Blood supply, this is a big muscle, it has multiple blood supply. It is getting blood from the branches of the external carotid artery, like that of the superior thyroid artery, posterior auricular artery, occipital artery, and also it is getting blood supply from the suprascapular artery in the lower part. The veins follow the arteries. Ultimately, vein opens into the internal jugular vein. Some of the part venous blood from there go to the brachiocephalic vein. Relations of the sternocleidomastoid muscle. This muscle is superficial and we found that this muscle, over the muscle we have the skin, the superficial fascia, platysma. In between them we have the external jugular vein. So external jugular vein is superficial to the sternocleidomastoid muscle, but the internal jugular vein is deep to the sternocleidomastoid muscle. And also posterior part of the sternocleidomastoid muscle is partly overlapped by the parotid gland, one of the salivary glands. The sternocleidomastoid muscle also covers other muscles like that of the superior belly of the omohyoid muscle, posterior belly of the digastric muscle, that is covered by the sternocleidomastoid muscle. It also covers the sternohyoid muscle and the sternothyroid muscle. The carotid sheath is under cover of the sternocleidomastoid muscle, and over the superficial aspect of the muscle we have the cutaneous nerves, most of them coming from the cervical plexus we have seen in our previous image. Okay, so these are the great auricular nerve, less occipital nerve, and the transverse cervical nerve, and these are coming out of the cervical plexus. Also have supraclavicular nerve here. Okay, this nerve passing, most of them passing over the sternocleidomastoid muscle. This, the great auricular nerve, lesser occipital nerve, and also the supraclavicular nerve, the anterior one, passing over the lower part of the sternocleidomastoid muscle. So we got the relationship, and between the two head of origin, this is the sternal head originating from the manubrium sterni. This is the clavicular head. There's a gap here. We call it lesser supraclavicular space here. Okay, and we got the relationship of the sternocleidomastoid muscle. So sternocleidomastoid muscle, over it we have the investing layer of the deep. It is covered by the investing layer of the deep cervical fascia. Over it we'll get also the platysma muscle. There is a subcutaneous muscle. Then we'll get the external jugular vein. Then we'll get the skin. Okay. Action when one muscle act turns the chin to the opposite side. Okay. This is acting now. And bends the head towards the shoulder like this. Certainly this movement is associated with other muscles like that of the scalene muscles and other muscles like the trapezius, the levator scapulae muscle and longus capitis muscle, but this is the muscle very important for the turning the chin to the opposite side and bending the head towards the shoulder. When both muscles act together, draw the head forward, and when they also flexes the neck along with the scalene anterior muscle. Okay, flexes the neck so that we can touch the chin to the chest. Okay, there is the action of both the sternocleidomastoid muscle from both sides. So we'll get some clinical anatomy about the sternocleidomastoid muscle. What is torticollis or Wryneck? Shortening or excessive contraction of the sternocleidomastoid muscle. Okay, it may be congenital, okay, or it may be acquired. We call it spasmodic torticollis. Twisted and tilted neck in torticollis. Congenital may develop prenatally due to malposition of the fetus in the uterus. That may lead to congenital torticollis, that is prenatal, or maybe postnatal due to birth trauma. Birth trauma may be vaginal delivery, maybe C-section, whatever may be. There may be birth trauma, there may be bleeding in the sternocleidomastoid muscle, leading to fibrosis and contraction. There may be entrapment of the branches of the accessory nerve, that is the motor innervation to the sternocleidomastoid muscle. Spasmodic torticollis begins in the adulthood. Trapezius may also be involved. Acquired torticollis is the result of tumor. There may be tumor here, maybe in the muscle, maybe in the neck. Okay, that may progress to the muscle. Trauma, any type of trauma, it may be road traffic accident or cranial nerve palsy, like that of the fourth cranial nerve palsy. Okay, muscle spasm, infection, or drug ingestion. Okay, that is spasmodic torticollis. So we may have some type of injury, and there may be cranial nerve damage, not only one nerve, multiple cranial nerve may be damaged, and we have to look at the movement of the eyeball. And that's all about the anatomy of the sternocleidomastoid muscle. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.